What bioethics questions do neuroprosthetics raise? Have you ever thought about how technology can connect directly to our brains? Neuroprosthetics are devices that do just that, aiming to restore or even enhance our abilities. But this fascinating technology brings up important bioethics questions that we need to consider. Let's break down some of these key issues. First, we have the concept of autonomy and mental integrity. Neuroprosthetics can interact with brain activity, which raises concerns about our freedom of thought. How do we ensure that these devices do not invade our mental privacy? It is essential that they are designed to protect our thoughts and identity. This way, we maintain control over our minds and prevent any unauthorized access or manipulation. Next, we look at beneficence and non-maleficence. The principle of beneficence means that these devices should provide clear benefits, like restoring lost functions. However, we must also consider the risks involved. Surgical complications or device malfunctions can occur, and there may be psychological effects, such as changes in self-identity. When we think about using these devices for enhancement rather than just therapy, the risks become even harder to justify. Identity and personal integrity are also significant concerns. Since neuroprosthetics interact closely with our brains, they can change how we see ourselves. This raises ethical questions about whether these changes are acceptable. If enhancements alter our cognitive or emotional abilities, we must consider how this affects our sense of self. Informed consent is another critical issue. Neuroprosthetic technologies are complex and new. It is vital that patients fully understand the potential benefits and risks. Informed consent should not just be a one-time event. It needs to be ongoing, as long-term effects may still be unknown. Social and cultural implications cannot be overlooked either. Neuroprosthetics impact not only individuals but also communities. For example, cochlear implants have sparked debates within deaf communities about medical intervention versus cultural preservation. We must respect different values and avoid imposing a standard of what is considered normal. Justice and access to these technologies is a pressing concern. Neuroprosthetics can be costly and resource-intensive, leading to inequalities in who can benefit from them. It is essential to ensure fair distribution and avoid worsening existing social disparities. Lastly, regulation and safety are paramount. Ethical practices call for strict standards in the design and monitoring of neuroprosthetic devices. This ensures that they are safe and effective while preventing unauthorized access to brain data. These bioethics questions guide how we develop and use neuroprosthetics, ensuring that we respect human rights and promote well-being in the face of advancing technology.